Today's lecture topic is the FIM. The FIM is another assessment tool that I'm going to be showing you in class, very similar to the Barthel, but it goes a little more in depth. So the FIM stands for Functional Independence Measure. It's an outcome measure comprised of 18 items, where the Barthel had 10, this one has 18. And they are used to objectively determine a patient's baseline level of function at the beginning of treatment. So it's another objective assessment. The same measure can be used at discharge to determine progress. So you use it at the beginning and you use it at the end to see how much progress your patient has made. When your patient comes in on admission, you want to make sure that the FIM is completed within 72 hours, and then again 72 hours prior to discharge. That's really important, especially for billing purposes. The FIM is a little more structured in that way than the Barthel is. The FIM measures a person's disability, not impairment, again, like the Barthel. It measures what the person actually does and not what they should or might be able to do. So it's another very objective one. You have to use the scoring guidelines that they give you. This is not discipline specific. Any trained clinician can complete the FIM. Some clinicians may find it difficult to assess certain aspects. In this case, multiple clinicians can assess specific areas. So you see here that communication is one of the items that the FIM is looking at. So a speech therapist may be the one that goes in and assesses communication, while the OT may look at self-care and the PT may look at transfers. And then each member of the interdisciplinary team is going to come together and share their information to get the most accurate score. These are the 18 items. So you can see there's basically the 10 of them that were on the Barthel with 8 additional items. So we have eating, grooming, bathing, dressing, which is broken down into upper and lower body dressing, toileting, bladder, bowel. Transfers are broken into 3 categories. So there's bed, chair, and wheelchair. There's toilet, and then there's tub or shower. Then it's looking at walking, or if the person does not walk, then wheelchair mobility is counted. Stairs, comprehension, so are they able to understand? Expression, are they able to express their needs? Social interaction, problem solving, and memory. Those are the 18 FIM items. So unlike the Barthel, scoring with the FIM has a 7-level scale, which is used to rate patients on their performance of an activity, taking into account their need for assistance from a person or device. The need for assistance or burden of care equals time or energy another person will spend on the needs of the patient. So this is important for when a patient comes in to know exactly where they fall, to make decisions on their plan of care, which pertains to nursing and therapy, and maybe some other areas like a dietitian, for example. So there's independent. Independent would be scored at a 7 or a 6. So a 7 if they are completely independent, and a 6 if they are modified independent. So they need a device to be able to be independent and complete their tasks. Or there's dependent, which falls in the middle. Patient requires another person for entire supervision or physical assistance in order to perform the activity, or it is not performed. So to fall under modified independent, they're going to be scored, or modified dependent, they'll be scored at a 5, a 4, or a 3. A 5 means that they need supervision or setup. 4 is minimal contact assistance, and a 3 is moderate assistance. For complete dependence, they will be scored at a 2, 1, or 0. 2 is maximal assistance. 1 is total assistance or dependent. And then 0 for activity does not occur. So you might see that with the stairs, for example, especially if somebody's in a wheelchair. Direct observation of the patient's performance is preferred. However, credible reports of performance may be gathered from the medical record, patients, other staff, caregivers, and friends. So, again, with this one, you want to be careful with getting your information from the patient. You might want to then contact a caregiver and see if they can paint a more clear picture for you. Look at the medical chart or talk to speech or PT. And whenever possible, you want to observe what the patient is doing, and that's going to give you the best score. So that's it for the PowerPoint. When you come to class, we're going to be doing scoring for the FIM. One of the things that I have for you is going to be a decision tree because there are more levels of scoring with the FIM. So this is very, very simple, helps you break it down. So you start here. Does the patient need help? Yes or no? So if it's a no, it asks you a question here so you can determine if they're a 7 or a 6. If it's a yes, then you're going to move down. And you're going to work through all of these questions to help you get to your score. So you're going to have access to this. You're going to have a case study and you're going to score the patient that you have on admission and on discharge. So if you have any questions, go ahead and post in the discussion board. Otherwise, I will see you for class.